Okay,
après-midi,
so to
la
finish
seconde
this
séquence de remise de prix
afternoon
de la
with the
Fondation Pierre
second
Fabre, je le
part
rappelle,
and the
deux
award
nouvelles
ceremony
initiatives en e-santé
for
qui ont évidemment
Pierre
le
Fabre
potentiel d'améliorer l'accès aux
Foundation
soins et aux médicaments de
with a certain
qualité
number
pour les
of
populations
solutions that can
défavorisées.
improve
Deux nouvelles
healthcare
équipes donc porteurs
for
de projets à qui on
populations.
va
We have two
décerner
new
ce prix
teams who
Odess.
will be
Je vous propose d'accueillir les
awarded this
représentants de la
Odess
première équipe et du
prize.
premier
Let's call
projet
the
qu'on va
representatives
découvrir
of the
en
first
images.
team and the
Il
first
s'agit de
project.
AI-Powered
It's
Respiratory Cloud et j'accueille, s'il vous
AI-powered
plaît,
respiratory
Bruce
cloud,
Menado
and
et
let's
Marie
call
Kawanga, s'il
Bruce
vous plaît. Venez me
Colado
retrouver sur
and
scène.
Marie Kawanga. Please come on stage.
Our project AIR is a low-cost monitoring device that detects the quality of air in the environment using artificial intelligence. So air pollution is an important public health problem because it causes lots of respiratory disease, heart disease, cancers across the globe. In the global south, many countries don't have the data that allows them to detect how bad is it, who is most affected, which areas are most affected, and what are some of the potential health outcomes. So our project addresses that gap by providing a tool that generates the data that policymakers need to intervene in reducing air pollution and the diseases that it causes. Our project is currently working in two provinces in South Africa, Gauteng and Mpumalanga. These are both regions that have a high concentration of mines and factories and other industries that have high levels of air emission in the air. The main beneficiaries of our project are the communities that live in the areas where our project is concentrated. And the other beneficiary, we believe, are the policymakers who need the data that our project generates so that they can intervene to reduce air pollution and its impacts. Our project is improving the health system by integrating different digital technologies, including air quality data, artificial intelligence, machine learning methods, and all of these are integrated into one comprehensive tool that is feasible to implement at fairly low cost to health systems. Our project so far has rolled out 300 sensor devices in Johannesburg, and already we're picking up spikes in air pollution and air pollution hotspots in Johannesburg, which is providing useful data that gives us impetus to extend the platform even further. So for our next steps, we intend to deploy 500 more sensor devices across the whole of our province in Gauteng. And our vision for the future is to extend even further nationwide, and also to try and design and deploy a system that is scalable in other countries in the global south using the same kind of technology. So we applied to Odess because we felt that our vision aligns with Odess's vision, which is the use of digital technologies in an innovative way and sustainable way in low resource settings, particularly in the global south. What this recognition has given us is really encouraged us and given us the momentum to continue elevating the use of African-led innovations at an international global platform.
Merci à tous les deux. Bravo.
Thank you very much to the two of you.
Congratulations for the explanation,
Congratulations.
Marie. Very good, very interesting. Thank you for being here. Merci à tous les deux d'être là. Expliquez-nous comment
Please
ça a démarré.
tell us, how did this all start? What's the genesis of this project?
Take the mic.
I can
It's
call.
here on the table. Thanks.
English?
Yes.
All right, so Mary and me, we are brother and sister in crime. So we did a lot of work in COVID-19. And as COVID-19 waned, it became endemic. We launched a deep think tank to understand where we're going to go with artificial intelligence and digital tools, and that was air quality. Now, the big conundrum of air quality is cost. Why are we not deploying systems in the global south and the global north is actually costing. And costing is split into two aspects. First, hardware. Licenses typically multiply the cost or the pricing by about a factor of 2.5 to 10. So we devise our own hardware in collaboration with some European companies, and that reduces the cost to basically be under $100 a pop. That's number one. And then we basically pass on this to government so that they don't have to pay for licensing. So that's a major cost reduction. The second is, okay, you bought all these systems, so what now? And that's the big conundrum, because that's actually the most expensive part, which is the modeling that comes with it and the intelligence that you extract from it. And that's where AI comes in. Now, if you ever watched The Big Bang Theory, I'm Leonard. So we do integration of, you didn't laugh hard enough. That means you haven't watched it. The integration of hardware, communications, and artificial intelligence into one system. And AI, what it's going to do, and it does now, following this brilliant explanation from Mary, the public health specialist, is to basically in real time interpret the data and provide insights of 500, 10,000, or 1 million sensors at any given time.
Yeah, I was going to ask you guys, what do you do with this massive collection of data? Qu'est-ce que vous en faites de ces données?
Thank you so much. I think that's one of the big challenges often with innovations that give you lots of data. It's like, what next? And I think the point of collecting the data, firstly, obviously, is to analyze it, but also to be able to develop sort of information products in different ways that you can give to policymakers, firstly, I think, about the problem of air quality. Where is it most affected? Where the area is most affected? Who's most affected? And what are the potential sources? In a localized way. I think what Bruce was saying earlier is if you have it, if you produce a tool at low cost, you can then have a wider coverage, and you can also find more. You can get data that's more nuanced for local areas. Because even in a city like Johannesburg, the air quality is not the same across the whole city. There's some areas where it's higher than others. So it's first being able to analyze it. And analyzing big amounts of data manually is not very easy. So that's where the AI machine learning comes in, and that's helpful. And the second thing about the data is, I think there was a picture there that shows the dashboards. The fact that once it's analyzed rapidly in real time, you're able to then project it onto dashboards that the public can access. And it's actually on the website where the public can access it. And they're then able, someone earlier even spoke about this, the fact that communities need to have access to the data so that they can see what's happening in their communities. And community action groups, we already have some community action groups in some areas in Johannesburg who are then able to see what's going on and then put pressure on policymakers to sort of say, look what's happening in our community and do something about it.
It is already in place. We saw it in the video. C'est déjà en place. Il y a 500 capteurs.
There are 500 sensors
are in place in South Africa. What's the next step? La prochaine étape, c'est quoi? And what do
what's
you
the
need?
next step?
De quoi avez-vous besoin?
Right. So the goal is to implement and scale, obviously. We are moving to the next phase of deploying 500, thanks to your support and others. So we have a three-pronged approach towards reaching national and continental scale. So first, we work very close with government. We are both funded by government, as a matter of fact. We work with different departments, municipalities, provincial government, central government, and federal structures to make sure that they're aware that cost-effective systems work as well as expensive systems, okay? Thanks to the AI, that they can afford it. Because there's this notion that, oh, you know, monitoring is going to be too expensive, why do it, right? So we have to break that dynamic. That's the first prong. Second prong is basically engaging, which we already do, the private sector. The private sector is, in fact, very responsive. In fact, I'm actually very pleased by the fact that everybody is very responsive, positively, in a positive sense of the word, towards what we do. And the private sector is giving a lot of in-kind contributions. They allow us to use their infrastructure, they give us their technicians, they provide security for our sensors, and so on and so forth. So that's certainly growing very fast as well. The third prong is citizen science. In fact, one of the things we realize when we put up all these tools and everything else is that we get hundreds, even thousands of requests from citizens to say, are you going to sell this so that we can deploy at home? Okay, and we were not ready, say, a year ago to do that. We wanted first to have a deployment to show that the technology can be scaled and is deployable at scale. We are now ready to do that. So in 26, we're going to move into a phase where we are going to interact with the population by selling at cost. So it's a 2.5 times cheaper than buying it online, so that the individual provides its own data and gets access to the data of neighbors at the same time. That's a concept that was invented by Purple A, and that we're going to replicate to further scale the numbers.
So why not doing it before? Pourquoi ne pas y avoir pensé avant?
Well, technically it's not as easy as it sounds.
Yes.
Because you need to test the technology, test the communications, and more importantly, test and develop the intelligence.
Yes, yeah. On va faire monter sur scène Léa Neijm, qui est chargée de recherche médicale pour la Fondation de l'Avenir et qui va venir vous remettre le prix. Venez nous rejoindre, chère Léa, et vous emparer d'un micro.
Léa, please grab a mic.
Venez, we're going to do a picture. Voilà, avec Lydie. Come up in the center of the scene for the picture. Tout ça est très solennel. Léa, j'ai envie de vous demander ce qui vous a particulièrement attiré, qu'est-ce qui vous a attiré votre attention sur ce projet en particulier. Expliquez-nous.
For this,
La Fondation
caught your
de l'Avenir
attention?
a pour vocation
the
de soutenir
Future
la
Foundation,
recherche médicale
Fondation
appliquée au bénéfice des
is here
patients.
to
Elle est
support research
reconnue
for
d'utilité
patients,
publique
and it is,
depuis 1988
public,
et depuis 2017, la Fondation de l'Avenir
it's
et
a
la
foundation
Fondation
of public
Pierre Fabre sont
utility, and
partenaires
with the
dans les
Fondation
fonds de
Pierre Fabre, we are
santé
partners
numérique.
in
Alors, ce
digital health
projet se
care
distingue
funds,
par
and
son approche
this
scientifique
project
et innovante
has a
face à un
scientific
enjeu
and
majeur
innovative approach
en
faced
santé
with a
publique,
major issue
la
for
pollution
public
de l'air.
health, which is air pollution.
En combinant les capteurs
As we
à
bring
bas coût
together these
et
low-cost
la communication bien
sensors,
sûr et l'intelligence
communication
artificielle,
and AI,
il est possible de
it is
détecter la
possible
qualité de l'air
to
dans les
detect
zones les plus exposées.
air quality in most
Alors, ça
exposed
illustre
areas, and this illustrates
la capacité de la
the
science
capacity
de trouver des solutions, de proposer des solutions pour les
people to find solutions
au service de la santé
for
des populations.
the health
Et
of
du coup,
populations,
donc,
and
cela étant dit,
therefore,
la
this
Fondation de
being
l'Avenir
said,
est fière
the
de
Fondation de
soutenir
l'Avenir
votre projet
is proud to
et
support
de
your
contribuer
project
en
and
partie à son
contribute
développement.
partially to its
Félicitations.
development.
Merci beaucoup.
Congratulations.
Merci.
Thank you very much.
You stay with us because there will be some questions. On passe au quatrième et dernier projet
Moving on
récompensé
to
cet
the
après-midi.
fourth and last
Il s'agit de Safe
project
Delivery
awarded
Plus.
this year.
Donner la vie ne
Safe
devrait pas coûter la
Delivery
vie.
Plus,
Et j'appelle Disha
Give life should not
Argawala
cost
et
life.
Arpita
I'd
Deb à
like to
venir nous
call
retrouver sur scène, s'il
Disha
vous plaît.
Argawala
Pendant qu'on découvre le
on
projet.
Stage.
Our project aims to strengthen the capacity of midwives across Asia and Middle East to improve maternal and newborn healthcare in the region. Maternity Foundation works in low and middle income settings with diverse cultural, political, and healthcare landscapes. The primary beneficiaries of the Safe Delivery Plus program are the members of the midwifery associations in 8 countries across Asia and the Middle East under Midwives Alliance Asia. The indirect beneficiaries include midwives in these countries. Safe Delivery app is a free online and offline tool that supports midwives in making informed decisions during routine and emergency care, while enabling flexible, self-directed learning suited to their daily work. Accredited in several countries, it also serves as a formal CPT course and can be used towards license renewal. There is an average improvement of 24% in knowledge, 22% in confidence, and 65% in skills in managing obstetric and neonatal emergencies among healthcare professionals. The app can reach users working in remote areas where connectivity is a challenge, and all content can be adapted to local culture and national guidelines. It therefore complements existing guidelines, training curricula, and teaching methodologies. To address connectivity challenges in remote areas, the app was designed to function fully offline. Once downloaded, ensuring midwives can access clinical guidance anytime. Adoption barriers such as digital illiteracy, CPT accreditation, complexities, and sustained user engagement were addressed through hands-on training, collaboration with national stakeholders, and in-app reminders to promote continued use. Our immediate next steps include engaging Midwives Alliance Asia and selected midwifery associations and develop a comprehensive country-specific training plan. We envision that the project will support long-lasting professional development for midwives by having trained midwifery leaders from 8 countries. We applied to Odess because we appreciate your commitment to advancing innovative and sustainable e-health solutions for underserved and vulnerable populations. We hope this opportunity will strengthen our visibility, foster strategic partnerships, and support us in scaling our solution more effectively.
Disha and Arpita, thank you for being here with us. Merci beaucoup d'être avec nous. Arpita, expliquez-nous la genèse de ce projet. Comment ça a démarré?
Arpita?
À partir de quelle idée?
What was the initial idea?
Thank you so much for the question, Sophie. So, the Maternity Foundation is working to improve the maternal health and newborn healthcare. And in 2015, Maternity Foundation had launched a Safe Delivery app. So, during the initial years, Safe Delivery app has been developed into many country language versions. And
We'll hear you better with this one.
thank you. So, during the initial years after 2015, the Safe Delivery app has been adapted into many country language versions. But we have slowly realized that only adapting the Safe Delivery app into country versions won't be enough, because it is very essential to improve the knowledge and skills of the midwives and the healthcare professionals, which only an app cannot do alone, because it is a part of the ecosystem. So the training component comes. So slowly the Safe Delivery app has evolved into Safe Delivery Plus program, basically, where we have integrated the training component. One, training is already a part of the application, which we are calling My Learning platform, where the users who are using this application can do self-assessment in the My Learning. Other than that, we have also developed customized training packages, where we are doing online trainings, hybrid mode trainings, and on-site trainings in different countries. It depends on what is the need of the country and what are the partners' needs, what is the best approach we can do. Based on that, we design those trainings, and now we are more rigorously focusing on the training part. Other than training, we are also trying to integrate Safe Delivery application into the existing country-based national programs, other digital platforms, pre-service and in-service training. So this is about the Safe Delivery Plus program. Now, talking about this project, which we are going to do now, here, instead of targeting we only on one country, we would be working in 8 countries from Asia and MENA region. So we are going to identify midwifery readers from 8 midwifery associations, because we are strongly working with the midwife associations. They would be trained first online and a on-site TOT, training of trainers. Then they are going to go back to these countries, and they are going to transfer their skills and knowledge to other midwives who are going to reach to the different remote areas, hard to reach areas, different provinces where traditional teaching is not possible. Sometimes internet connectivity is an issue. So midwives are the only people who can reach those areas and transfer those skills.
Another question, can you really study, do you have any result of the impact of this Safe Delivery program? Est-ce que vous avez des résultats déjà probants sur l'impact de ce programme?
Yes.
talking about the versions, now the users of Safe Delivery Plus Safe Delivery app are from more than 100 countries, out of which 70 are from middle and low income countries. As I mentioned, we have more than 40 plus language versions, and in global version we have 5 languages. And other than that, in terms of reach, we have been able to reach 500,000 healthcare professionals, which is updated what we have seen in the video. And the datas have also changed. We have successfully completed 29 projects, out of which whatever the data we have assessed, we have seen there is a 27% increase in knowledge, 24% increase in confidence, and 68% confidence in skill, which we have seen through the trainings we have been doing across the globe.
That is good. Thank you very much. Je voudrais qu'on fasse monter pour remettre
right, in order to give you the award, Bertrand Parmentier, administrator of the IPFA Foundation, please come on stage. Bertrand, tell us, why did you choose this project rather than another? Well, before I do this, maybe we could tell you more about our approach at Odess, which is gaining momentum. This year, we had over 347 projects presented to us. 139 were eligible in the view of our criteria: interoperability, proof of concept, capacity to scale up, insertion into governmental ecosystems of public health. And as regards these 130 or so projects that were eligible for the second phase, we shortlisted 12, and these 12 led to investigations on the field, so in Nepal for this project. And just to show you how serious we are, and we are delighted to be able to have you today. Now, for this project more specifically, according to the data of WHO, 80% of mortality linked to delivery could be avoided. What seduced us in this project is that it's a free app which works online or offline, which is in line with the recommendation of WHO. And it is an app which I would say its developments target to adapt to the context with a scale-up speed which is quite incredible. When we looked into this project, we were talking about 5 main languages, or nearly most of 35 local languages. And in fact, you mentioned 40. Since the inception of the project, we were talking 400,000 people impacted. You mentioned 500,000 beneficiaries now. As regards Nepal, where we went on the field to check this out, we saw that there are already 4,000 beneficiaries just in a few months. And what seduced us also was this association of networks of midwives of 8 Middle Eastern countries which are weathering quite strong crises: Iran, Afghanistan, Yemen, and Bahrain, the United Arab Emirates, Nepal. And so this openness and this desire to for mutual learning truly seduced us. So these are the main criteria and reasons why we selected this project and why we're delighted to be able to award this project. Thank you, Bertrand. And now let's take a few questions, and in the chat, I can see a hand over there, and the lady further down. And we'll see if we've got questions on the chat.
Ladies first,
yes.
maybe?
Ladies first, maybe.
Sorry.
Hello, thank you so much for the presentation. The projects are really quite impressive. I'm Tania Kumu, I'm from the University of Barcelona, and I would like to ask the AIR team, you mentioned that in the next phase, or part of the next phase is that you're going to sell the devices, air quality devices to the citizens, and they would have their data on these devices, and they would also have access to their neighbors' data. You know, there's a lot of issues regarding data privacy, so I wanted to understand what kind of data would they have access to, or what kind of data would they be sharing and also accessing for their neighbors, and how would you make sure that it's done in a secure way?
Interesting question. Bruce Marie. It's not personal data, is it?
Yeah, no, this is a geeky question for the geek in the room. Yeah. So
bring the mic close to your team.
Okay,
there.
so
Yeah.
Obviously we have gone through all the questions pertaining to ethics and the legality of, we have in South Africa what we call the POPI Act, pertaining to data that's private. Now, as per our law, and the law of the land states is that if somebody wants to advertise the air quality that stems from the area where they live, we have the permission to advertise or put on the map the location and the quality of air. Okay, so the quality of air is not regulated and is not considered a personal data. Okay, it's considered environmental, where the only issue would pertain to location. So if the individual wants to share the location with the community, he or she does it, and the data becomes public. Now, this concept has already been worked out by Purple Air. They, unfortunately it didn't work out because it was a for-profit activity, whereby they were able to sell 200 systems, and everybody was sharing the data and so on and so forth. They were selling their sensors for about almost 3 times more. Okay, they were making money there, but their business model was based on the fact that they wanted to use this data and sell it to governments or the private sector. That didn't work out. Now, that's not our intent. Our intent is that data be publicly used by specialists, the public, and government and so on, and that everybody shares and provides input to the system.
Thank you. On prend une autre question. Alors, monsieur.
Let's take another question from the gentleman over there, because I gave the floor to ladies first. Yes, thank you very much. I would just like to make a little comment as regards the implementation of these sensors. I see a great opportunity in understanding links between air pollution and certain diseases. I think you didn't really insist on the impact that this may have on the comprehension, and I believe that today air pollution is listed amongst one of the main causes for cancers and many chronic diseases. I am very much interested in drepanocytosis, and we know that patients suffering from this disease suffer from it the most, and when they are in an environment where air is pollution. And so I suggest you work with specialists in order to try and find correlations between air pollution and mortality rates. I have a colleague who's working on these questions, and there are sensors for air pollution, and we gave our patients on their iPhones a geolocation which enables them every time we analyze the data of their crises. But I mean, these are diseases that are multifactorial, and air pollution is not the main cause, but it is an element that needs to be taken into consideration nevertheless.
Specialist, I guess you do.
Yes, thank you. Totally agree with the point that's being made. And absolutely, I think air pollution, according to the WHO framework for non-communicable diseases, was added as one of the top 5 risk factors for non-communicable diseases. So certainly an issue that we know needs to be addressed. And I think you're correct, absolutely. I think the first step is first to have tools that tell you how big is the problem, where is it, who's affected, in a more nuanced, localized areas. Because currently, as Bruce was saying, the sensors we have in South Africa are very widely spaced apart. So to be able to sort of do correlations for the whole of Gauteng is very difficult because it's such a big area and there are many variations. So I think with this data that gives us the environmental exposures, the next step is to then start correlating it with health outcomes. And I think there's different ways of doing that. One can start tracking the health outcomes and putting them into one system and seeing if you can integrate that. And I think as a start, one can start correlating it to existing surveys that are being done on the extent to which populations are suffering from different conditions like chronic respiratory diseases, cardiovascular, et cetera, but that is the point. That is really the point. It's not an end in itself. It's a means to an end. And so, yeah. Thanks.
Thank you. On a une question. Oui.
My question
We have a question.
Very similar. So very familiar with purple air as from California, where wildfires have been a major issue. I think to this question, we may have access, like in California, to data around healthcare, around air health, I should say, but not action as far as what the consumer can do to protect themselves. And so maybe a dual question for both sides is how do we then move the data to the consumer side of information? How do I then, if I know that there's bad health in my area, protect myself from the bad air? Or on the maternity side, wonderful to train midwives and very needed, but then how do we move that to pregnant people being able to have access to that information and making sure that their providers have access to, adequate care or what they can do to prevent major maternity health issues? Thank you.
Arpita, you want to answer first?
Yeah, thank you for the question. So basically, our direct beneficiary of the app are the midwives and the healthcare work professionals, not the pregnant mothers, but definitely they are our indirect beneficiaries. So definitely they are not able to access the application because of many other reasons like digital illiteracy, like we mentioned. So obviously, but we are targeting that the healthcare professionals who are getting access to the application, they have a feedback section in the application itself. So if they have any comments, if any questions or concerns, they can put there. And also we get the feedback testimonials from the field also, like wherever we have trained any trainers in any particular country, we have created a community of practice over there. So we have a WhatsApp group, so we keep in touch with them. So we meet them like quarterly basis, time to time, to discuss about what are the challenges, what are the lessons learned. And sometimes they come from their region and say that, okay, we are unable to download the app because there is internet issue, electricity problem, or maybe we are unable to tell any other people. So that time there also we have certain kind of solutions, like we try to provide them with APK files so that they don't need the internet connection to download that particular file, because that works as well in offline condition also. And there are some other midwives also who are not aware of the app. They transfer the awareness also, they create awareness also. And they are also giving us the testimonials that previously we are not confident enough to handle a complicated case like normal labor of birth case, but now we know what exactly step we need to do. Like we said, this application is a hands-on, like we have recently published one article also. Some people have said this is like a book in my palm, so wherever I go I can keep it with myself and I can refer to it in whichever condition, like in health facility or hospital. So yes, so our direct beneficiaries are definitely not pregnant mothers, but from the testimonials, from the community of practices, the feedback which we are getting from the midwives, from where there we can say that definitely we are able to contribute to improving their healthcare. Thank you. I think I have addressed the question.
Yes, very much. Bruce and Mary.
Yeah, so incidentally, Purple Air was started by a South African businessman, by the way. It wasn't Elon Musk, but, somewhere in that direction. So one of the issues that Purple Air had, it was a structural inherent problem, is that it wasn't sufficiently intertwined with the public health system. Okay, that's one of the issues, one of the lessons you learn from Purple Air. Now, we, by construction, as we are essentially part of government in that sense, we work together with the public health system, the public health ecosystem, both at the national and provincial levels and municipal levels. What does that mean? That in this new phase, the 500 systems we're going to deploy, we're going to have sensors in every single clinic and every single hospital in the south of Gauteng, which is highly industrialized. So you have the data, not just of the place where people go with disease, but also where they came from, because we also deploy in populations and underserved communities and so on. So you basically end up having the ability, as already Mary, who speaks so well and so clear and so fantastic, already put it very clearly, is that we will have, with the amount of data we will get, we'll have the ability to correlate geospatially and temporally and within the context of the public health system.
You want to add something, Marie?
Yes. Just to add to what Bruce said, I think to the point also, which is about how can communities actually advocate. And I think we've had the experience, I think, in one of the areas where we've been picking up some hotspots, air quality because of combustion, waste, etc. Community groups. So civil society sort of community organizations are very interested in this kind of data because I think they sort of speak as the voice of communities that they represent in their neighborhoods. And so that's, and they sort of know that they can at least have some information that they can use when they go to the local councillors to say, look, this is a problem in our area, et cetera, et cetera. And that's something that they were really looking for, that could show that their area is actually affected. Whereas previously, I think the data just says the whole of this province or the whole of this city has got pollution like this. What this tool does, it allows people at a more local level to be able to, you know, use it as advocacy with their politicians. Thanks.
Right. On a une question une question ici et puis là et puis après le chat. Je vous en prie.
Merci. Je vais faire en français. Bravo lauréat.
I'm going to speak in English. Thanks very much. Well done to the award winners and well done for translation. I think that my question has to do with data, about political resistance, because the data can be a problem. How can you convince people, for Bruce and Marie, how can you convince politicians to find this resistance? If you want to really expand the sensors to other regions, what kind of message you can convey so that they can accept?
Counter political resistance.
Actually, I have to say that we've been very pleasantly surprised by how well we've been received. I don't think we've received pushback from government at any level. The issue with government is, of course, lack of resource. Okay, that's the big issue. And in South Africa, you have to basically create a narrative that slowly but gradually is adopted by government to create items in the budget to act on it. Okay? So that certainly is a process, and in doing that, we basically do a scaling, the risking, and so on and so forth. But I have to say, I'm very pleasantly surprised by the reaction of government at all levels, the public, the newspapers, TV, and everything. They've been very, very welcoming of the initiative. It's just that you have to do all the heavy lifting to bring something that is cost-effective into something that's deployable at scale, and that's really where the complexity comes from.
Well, journalists are kind people. I said journalists are kind people.
Not all of them.
We'll talk. Marie, you want to add something? No?
No, I think,
okay.
I think it's covered.
On a deux questions dans la salle. Oui?
We have two more questions in the room.
Allez-y, l'un ou l'autre, on prendra les deux.
Alors, merci.
Yes. come from Senegal. I heard everything since this morning, all different projects. The main question I want to put you is what is the level of collaboration you have between technical teams that are really on the side of new technology and the practitioners that are on site, working with midwives, for example. In your teams, do you have midwives, doctors, gynecologists? How do you work together? Because we don't see that. We only see the IT aspect, use of the application. We don't see all the understream work. Because where I work with people who are specialists in IT and to work on application for patients' file. There's big work to do, up to 5 years to create something that can be used concretely, and they come every day, to work in the service. I would like this aspect to appear in the presentation so that we understand how it all works, because the results are absolutely extraordinary. I have to underline that. Thank you.
Okay. Thank you for the question. So that's a very interesting question. Yes, we do have midwives in our team. In Maternity Foundation, we have clinical team who are basically responsible for undertaking the entire process of clinical adaptation of any clinical modules. So when I say that we are going to develop a new SDA, for example, Pakistan, so definitely that will take around 1 year, where the entire WHO guidelines would be aligned with Pakistan's national clinical guidelines, which would be primarily done and led by our clinical team from Maternity Foundation. Along with, we also have expert review committee, obstetrician and gynecologist in our organizations, independent review committee. And these manuscripts are only getting finalized from the Ministry of Health from that particular country. Like before launching any application in that country, we need approval from the Ministry of Health. So definitely from midwives till ministry, everybody is involved in the entire process.
Thank you. We had one last question. We're a bit running late, so it will be the last question.
Yeah, thank you.
Pardon, dernière question.
I'll try to be short. Thank you for the South African team and the other winners. The issue around air pollution, this is a space where UNICEF is getting into very seriously, because we realize that if we don't address air pollution, all the gains that we made elsewhere will just disappear, with the burden of diseases or conditions linked to air pollution. So my question is more around, each of the government has the responsibility as part of the agreements that they have with all the UN agencies and all, even the accountability to their population to monitor and report on the quality of air. And I know agencies such as the UN Environment Agency, they are kind of advocating a lot on that, and they are supporting countries in setting up, captors to monitor the quality of air in cities. And not only external quality of air, but also in-house, indoor air quality is becoming an issue. Apparently, it's even worse than in many places. So my question is, how the work that you are doing, how does it fit into the role of government in actually improving air quality? Because they are supposed to install captors all over the place and report on a daily basis and inform citizens through messages and alert messages on the air quality on the places where they reside. So I'm just wondering, because the way you're presenting it is as if the government is, in fact, does very little, and now you are actually supporting the government expanding the work. So can you clarify on that? Thank you.
Okay, so quickly, air quality is hosted by the Department of Forestry, Fisheries and Environment in South Africa. And they deploy what we call calibrating systems. These are very expensive stations that sit, there's about, I forget how much, 100 and something across the country. They are extremely expensive. So the advisory we provided to government is said, look, it's unsustainable to deploy expensive systems everywhere. Regardless of how accurate the measurement is, you're only probing within 500 meters of where the station is located. So the solution to that is to basically attach to the existing system cost-effective systems that surround the calibrating stations and make sure that the drift is under control, calibrations are under control, and so on and so forth. So it's basically to surround the existing system with cost effects. So that's a strategy has been adopted. Now the next challenge is to say, okay, is artificial intelligence and the integration of the system at a point where we can go and deploy 100,000 systems? Okay, so we are a year, 2 years away from it. Okay, but this is not in competition or against. In fact, we are a part of the DFFE in that sense. Is more basically the demonstration of the technology is advanced enough so that government can come in and say, we are going in that direction, invest in such and such item in the budget for it. Okay.
Well, thank you very much. Merci beaucoup à tous les quatre et bravo. On peut les applaudir.
Thank you very much, the four of you, and well done.
Merci
Congratulations beaucoup. For your projects. Thank you.